Okay, so we're going to finish talking about asthma and get into COPD, and then we will move into the expansion disorders along with vascular problems as well. So the first one is asthma. Okay, so again, this is periodic episodes of reversible obstruction within the bronchial tubes. This is where the bronchial tubes are closing up due to a hypersensitivity to some sort of pollen or just reacting to like dandruff or something like that. Okay, the key word here is periodical, meaning that it's going to happen every once in a while, and it is reversible, so it is going to be able to go back to normal. Okay, 1 in 11 children have asthma, whereas 1 in 12 adults have asthma. So it is a pretty good widely spread disease among people. 9 people die from asthma attacks every day. Okay, so it's not definitely a mild disorder by any means. Okay, in the last decade, we've had an increase of 15%. We've talked about in class that this was due to the fact that people are way too clean here in America. Antimicrobial everything causes our immune system to react to everything way overboard. Okay. So what's going on with asthma is we have two basic types. So we have the extrinsic type, and this is a type 1 hypersensitivity, and this is usually occurring in our children and will go away by adulthood. Whereas the intrinsic asthma is we are actually responsive to particular things within our airway. So again, the pollen, dandruff, any other type of irritants that can cause this. Respiratory infections can actually set them off, exposure to cold, exercise, drugs, okay, or any other type of irritants like that. Okay, and again, this is going to happen more towards adulthood. When asthma is occurring within the bronchial tube, we have 3 different things that are going to be going on. Okay, so we have inflammation, which is going to narrow those airways, which is going to make it hard to breathe. We also have contraction of the smooth muscles within the bronchial tubes as well, so that's that bronchial constriction, and that is also going to make everything much harder to breathe. And then our last change is that we're going to have more mucus in the area as well, and that is also going to increase the amount of stuff that we have going on within our lungs. It's going to make it hard to breathe. There can be just a partial obstruction where we have some air getting through, not a whole lot, but some. Okay. With this is still going to cause us some problems because we have some air trapping going on. Our lungs are going to be hyperinflated. We will see this again with emphysema. Okay. Then there's total obstruction, where we have a complete blockage, whether that is the bronchial tube has swollen so much that we have blocked the airway, or we have a mucus plug that is in the way that is blocking the airway. Okay. When we have a total obstruction, again, where the air has been trapped, we still have air in that area, which means that our lungs can circulate and can use the oxygen that's in that part of the lung. But as soon as it's been used up, there is no more air in that area, and the lung will collapse in that section. Okay, and then we have the status asthmaticus, and this is where we have attack after attack after attack, and we can use an inhaler in between to help assist with it, but it's not going to do us a whole lot of good. So this is usually the severe attacks that we're talking about that's causing those deaths. So for the most part, people usually have a family history of this, either just severe allergies or asthma in general, any other type of allergic reactions that could be happening. We also said that a sedentary lifestyle could also kind of trigger this, just because children are indoors a lot more than they used to. Their bodies are not used to all of the pollen and stuff that's outside. So when they don't go outdoors, their body kind of freaks out when it does and overreacts to things. Okay, being exposed to air pollution is also going to be something that's going to cause them some problems. Okay, so with asthma, they're going to be coughing, they're going to have difficulty time breathing and feeling a tightness in their chest where they can't move the air as adequately as they used to. They're going to have some wheezing noises that we talked about with our breath sounds. And they can also have some labored and rapid breathing going on as well. And obviously their oxygen levels are going to be down. Okay, this can lead them into respiratory distress, and the respiratory distress can lead to failure. And we will talk about these two disorders at the very, very end. So treatment for asthma, first thing we want to do is minimize the number of times that they have attacks for this and try to keep the severity down to a minimum as well, because that's going to help us kind of get a control on it. So the first thing we want to do is determine any sort of allergies that they may have. By doing skin tests, let us know what exactly they're allergic to. Is it dog dandruff? Is it oak trees? Is it a particular type of grass? Anything like that that's going to let us know. Okay, we'll need to keep them away from that in order to minimize these attacks. So again, avoiding triggers. So if it is cold exposure, try to keep out of the cold, especially if it's extremely windy outside, or respiratory infections, trying to prevent any of those from happening as well. Okay, we also want to have good ventilation, meaning that we're always having good air that we're breathing in. We don't want to be working in any situations that would further damage our lungs. Okay, and then we can do prophylactic medications. So this is things that we can take to try to keep our attacks down to a minimum as well. So a leukotriene receptor antagonist like Singulair can help us. Things like Allegra, Claritin, the Zysol, any of those medications are antihistamines, which are good, but with this type of medication, this is really going to keep these attacks down to a minimum. Okay, we want to teach them breathing techniques and how to reduce their anxiety. If they ever wind up somewhere where they don't have their inhaler with them, we want to teach them how to be able to control their breathing so that they can get out of the asthma attack without just full-on panicking. Okay, so the breathing techniques are also helpful just in general for them to learn and to know how to do so that they don't, again, have that anxiety with it as well. So we will talk about pursed lips breathing when we get to emphysema. Okay. Definitely want to carry your inhaler at all times. Okay, have a lot of individuals that will come into the clinic here at the school that they just don't carry it with them, and they say, "Oh, I'm having an asthma attack." Well, where's your inhaler? Oh, it's at home. Okay, well, that doesn't help us. We don't have inhalers sitting in the clinic. You have to have your own. Okay, especially if you're somewhere where you're not around anybody else and you don't have your inhaler. Again, those controlled breathing techniques are going to kind of help with that as well. We can do steroid treatment if the inflammation within the lungs is really bad. So taking things like prednisone is going to help keep that swelling down to a minimum as well.